Hello to everyone. Welcome to this special panel on SEWA AIFW, which has created direct and digital services for South Asian Americans in the Midwest US. And before SEWA, these people had come from many different places in South Asia and also in Latin America. The Indian migrant population was very large, but they didn't have any identity in the Midwest. They didn't have anywhere to go for help or services. And a woman named Raj Chaudhary, who's with us today, and her husband felt that this could be very important to give the Asian Americans a connection. And this has grown from putting pagers on women to track violence in your home, Raj, into a separate building, a center, a home for SEWA. It's a wonderful story how they have identified a social need and created their own unique, culturally sensitive program. So thank you for coming. And Raj, would you please tell us a little of the history of SEWA?
Absolutely. Thank you, Lois. Thank you so much. And good afternoon to all. I'm really honored to be here in this panel discussion and talking about the South Asian community and their needs and issues. My name is Raj Chaudhary, and I'm one of the founders of SEWA, Asian Indian Family Wellness Program. And it was formed in 2004 after seeing the needs of the community. I will talk more about the history and the programs later on, but let me introduce you to our co-executive director, Mubina Qureshi, Dr. Mubina Qureshi.
Thank you, Raj, for opening, and thank you, Ms. Harman, for having this panel together for SEWA AIFW. I'm Mubina Qureshi, I use she and they pronouns. I am Executive Co-Director at SEWA AIFW, Asian Indian Family Wellness. SEWA means to serve in Hindi and many other South Asian languages. And AIFW stands for Asian Indian Family Wellness. I am leading gender-based violence prevention and intervention work and mostly looking over on the gender-based programs. We have our staff members, including the executive team, today on this panel to talk about the gaps in the services that we see in the communities in Minnesota, Global South communities, immigrants and refugee communities that face violence in different forms, including gender-based violence, racial discrimination, systemic violence that we face in different systems of a different country when they come in here and unable to connect with the appropriate services. So as a direct service provider, we have built in a lot of different programmings for different age groups, focusing on different, frameworks, but mainly focusing on our BDJ framework, that is belonging, dignity, and justice. And with that, I want to invite our executive co-director, another one that is here, Dr. Dashrath Yata, who is taking care of our healthcare initiatives as well as civic engagement. And as we do not have our another participant and volunteer and one of the founders, Dr. Surinder Singh Chaudhary, he will be also talking about the men's circle that is for South Asian men in Minnesota to join in and learn about different ways to connect and be effective in allyship to the women and girls and LGBTQ plus communities. So I will invite Dr. Dashrath Yata to please introduce himself and talk about the programs, but mainly the introduction, and then we'll have like introduction for all the panelists here.
Thank you, Mubina. Thanks for introducing it. It's a great occasion to talk about our program here. Hello, everyone. Good morning. Namaste to all. And happy Women History Month to everyone. My name is Dashrath Yata. I'm the Executive Co-Director here. My role is Executive Co-Director. I'm leading the multiple programs, especially health initiative, including mental health, suicide prevention, civic engagement, community outreach activities, supervising senior programs and HR. As the executive coordinator, I will helping some part of administrative duties as well. Today, I'm going to talk about health initiative program. That is one of the key program for us, including mental health. I'm also talking about the South Asian Men's Circle program and civic engagement. So I will start with one health quotation here. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infinity, quoted by a World Health Organization. I would like to quote one more quotation given by Father of Nation Mahatma Gandhi regarding health. It is a health that is real wealth and not piece of gold and silver. SEWA Health Initiative Program focus on meeting the health needs of the community, our South Asian community and Indian community. So we have so many health disparities in the communities. So we are trying to fill the gap, those gaps in our community. So that is the reason we did the one health survey in the year 2013. So basing on that survey, we got results that we have a diabetes and heart diseases are major acting diseases in South Asian community in Minnesota. That is the reason we started community-based health clinics to address the health issues in the community. So through these health clinics, we are doing chronic disease management in the community. In the clinics, we will do the basic screening, consultation, and referrals, and nutritional education. SEWA mission is the total family wellness. Total family wellness means men, women, children, seniors. Total wellness means physical, mental, emotional health. So our SEWA clinic, we have a mission statement as well. SEWA clinic is a licensed medical clinic and education awareness clinic to provide means to achieve a healthy life and provide medical consultation, including healthy diet and activity. So what activities we are doing in the health clinics? So I would like to explain a little bit now. So we are doing the basic screening like blood pressure checking, blood glucose testing.
We are just doing the introduction first, and then I'm coming back to you to talk more about the programming and the ways we are tackling the healthcare disparities in the communities. Dashrath.
Absolutely. Okay.
Yeah.
So I can.
Sorry about that, but.
All right. So yeah.
We are doing a quick first round of introductions, and then we are coming back to each of us to talk about the programming. I'll quickly ask our other panelist, Amina Baha, who is our Refugee Settlement Programs Director, as well as taking lead on the women's programming, to introduce herself and briefly talk about her role.
Hi, good morning and good afternoon, depending on where you are. My name is Amina Baha. I'm new to SEWA. I'm a first-generation immigrant from Afghanistan, and I grew up in Minnesota. I've kind of had I guess, a wild roller coaster sort of a background when it comes to career and passions. I got into community service, but my career and academic background is in information technology, computer science specifically. I have certifications in project management and led a lot of those programs in the for-profit corporation world before I delved into the nonprofit world. This was especially after I had kids, and as an Afghan, my whole purpose was to challenge and change the narrative of how Afghanistan and Afghan women are portrayed in the media. And of course, that even extends to South Asian women. So that's a little bit about my background. And I started a nonprofit here in Minnesota back in 2017, and it really took off when we had the sudden evacuation of Afghans from Afghanistan, and our whole purpose was to resettle them into Minnesota and make them feel welcome and at home. And as we get more into the programming, I'll talk about why those services are still needed today by that community and the rest of our population. So thank you.
Thank you, Amina. The next panelist is Aarti Raghavachari, who is our youth engagement representative. And I invite them to talk about the role and the position that they hold.
Good morning, good afternoon, everyone. My name is Aarti Raghavachari. Thank you, Dr. Mubina, for the introduction. And yes, I do serve as a youth engagement representative for SEWA. I have been part of the organization for the last 1.5 years. And I have been both creating and planning activities for 13 to 24-year-olds within my role. And I also assist in gender-based violence preventative work in the space as well, and also assist with women's programmatic work as well. So I come into the space with academic background in international relations, political science, Chinese and international human rights. That's my academic background, but I have a strong passion towards grassroots movement and organizing, as well as nonprofit organizing. So one of my biggest goals and passions is to create safe space for young LGBTQ plus identifying AAPI folks in the community, just to have a safe space, because it's not something that I grew up with, even though I grew up here in the US from Ohio. So even with that, I still notice the gaps that exist in our communities, and I'm passionate to making for a better, more inclusive space. That's a little bit about me. I am a younger person as well. So I am a youth, and I'm very passionate about working with other youth and those who are younger than I am, and giving resources that are beneficial for them to take initiative and be leaders in their space as well. Thank you.
Thank you, Aarti. We have Rohini Ramanuj with us, who is serving as Seniors Program Specialist at SEWA AIFW. And I invite her to introduce herself and talk a little bit about her role at SEWA.
Hi, I'm Rohini Ramanuj. I've been with SEWA for 4 years right now, and I am the Seniors Program Specialist. Actually, this program started during 2020 when COVID time and also George Floyd incident happened, and our office had to be closed. And actually, at that time we had a lot of demands for meals and everything. So we were practically, Raj was looking for a place. So I volunteered and said my house is big enough for starting there. So that is where it started. And also, I'm also with the seniors, we are working a lot of programs like transportation, dementia screening, homemaker. And then we do walk with these. The seniors come here once a week. They come here, and once on Zoom. And even the senior social started during the COVID because they were all stuck at home and the seniors were feeling lonely and they were getting depressed. So we started it then, and now it's going on. They would like more number of days to come in. And I am working with a lot of the seniors with all the programs here, meals delivery and homemaker, then dementia, and a lot of programs.
Thank you, Rohini, for the introduction. At this point, all of us have almost talked a bit about our program areas. And yes, I see Ms. Herman.
Yes, Lois, yes.
Yes, please.
I think it would be meaningful to our audience to have a little bit of a picture of who are the women who come to SEWA. And it used to be more of a custom that Indian families with means would send their son to another country, often to the United States, and they would study and get an important degree. And then the parents would say, it's time to get married. And they said, you have to marry an Indian girl. You'll have to come home. We will have a big wedding. And that's how they do it. And the parents make a big part of the decision on who will the girl be. So they have this beautiful wedding in India. And then the husband takes her back, possibly to Minnesota, where there's some really important technical jobs like 3M, others. And this young woman, if she's lucky, he will be kind, he will help her adjust, she will find friends. But if she's not lucky, she will find herself very lonely and reaching to her parents who may come over too. And so you can have a multi-generational audience that you serve. I think that kind of puts the frame on that. Some of the women come really not because they are in school or they have researched it, but because they get married. Okay.
Sure. Yes, so there have been a lot of discussions around that narrative of, having this American dream, getting married, coming here, and then facing the struggles together. Some of them are not, and most of them, I would say, because there are a lot of limitations for the immigrant population, and specifically for those who come here on dependent visa, wherein the husband is holding the power over the visa status, medical insurance, passports, even their documents, all of that. So there are a lot of disparities among the families and the power structures that lot of families carry over from their native countries from South Asia, whether it's India, Pakistan, Bangladesh, Nepal, Bhutan, lot of Caribbean islands wherein a lot of Indian diaspora lives, South Asian diaspora lives, and other Guyanese, Guyana and other areas. So yes, we have been tackling to those issues. And I would love Raj to shed some light on the history and give us some overview, what inspired her to initiate this project and what made her feel that there should be a resource hub like SEWA. Back in 2004, and now we are talking down the line 20 years after the initiation of that, the seed of thought that we need something for the women. And I would love to invite Raj to talk more about that.
Absolutely. Thank you, Mubina. Where should I start? it starts with the whole history of SEWA starts with 1967 when we arrived here. At the time when we came to Minnesota, there were only 10, 12 families. Why were we were part of the quota system where only professionals were invited to the country to help them. A law was passed in 1965, an immigration law, whereas the quota was finished. The Immigration and Nationality Act abolished quotas, opening the doors to those who can contribute to this country. So I was part of that whole era in 1967 when we arrived. Right after when we arrived, there were 10, 12 families, as I said before. But then in 2010, the field had opened up. There were businesses that were allowed to come. And with that came the relatives and not necessarily everybody had literacy. There were literacy issues. There were all kinds of issues going on with the newly arrived families that came here. SEWA was incorporated in 2004, seeing the needs of the community. There was a call, because we were early settlers, the community would just reach out to us. What can we do? If there's domestic violence, they would reach out to us. There were several issues. Somebody had to start it, and there were 4 or 5 like-minded people. Ms. Lois Herman, Mrs. Mohini Giri, ex-vice presidents, Vivi Giri's daughter-in-law. There was Suman Mathur and Krishna Mathur, like-minded people. Mr. Atul Sharaf. So we all got together like-minded in a basement. And we thought something has to be done. So someone has to take the lead. And we did. My husband, Dr. Surendrapal Singh Chaudhary, was a big part in putting this together. We had several meetings with Lois Herman to get this organized in a way that we could establish a SEWA. And the name itself, to serve the community. Serve in Hindi is SEWA, Asian Indian Family Wellness Program. So we started out with that, but then where do you draw the line? All the people that are of South Asian descent with like culture, food, religion, they were reaching out to us. So we gave them a space, we organized ourselves and started this organization in 2004. Mrs. Mohini Giri was visiting at that time. And I asked her, I said, I have this vision of starting a women's program. She said, well, I'm here, launch it now, this weekend, today, launch it. So here we are. We rented a hall in Century College in St. Paul, and we launched the program. 65 community members showed up. We knew the need was there. And because my husband, Dr. Surendrapal Singh Chaudhary, and myself, we spoke about it, I was given the task to be the director at that time. So you said it, you opened the door. So here I was ordered to perform the duties of the ED at the time, which I accepted because somebody had to do it. And here I was sitting alone at India Association at the Landmark Center, all alone on a table, and having a few brochures, especially the control, immigrant women's control wheel. We became members of Violence Free Minnesota. It used to be Minnesota Coalition of Battered Women. We used Sakhi as our mentor organization and borrowed their knowledge, their references, the program. We used each other, the collaboration of communities coming together. It just didn't happen just one organization like ours. It was the amalgamation of many, many organizations. We partnered with many locally as well as internationally, as well as nationwide. We were hungry to collect the information, the resources, how we can help our community. There is still now a crisis line, 952-912-9100 is a crisis line. 24 hours we are working to trained advocates are answering the call. So we became members of Minnesota Coalition of Battered Women, learned all the tools of the trade, the domestic violence 101, 40-hour training is now being given to all our staff members. Whoever walks in the door becomes a part of SEWA, gets the training. Trained volunteers. The big break, it all happened 10 years. Nobody listened to us. Until 2012, we did a South Asian assessment, health assessment, got the IRB approval, partnered with the University of Minnesota and did this assessment. Everybody said, well, where's the data? I said, data? What are you talking about? I'm facing this data every day. We get calls for domestic women being battered, being married, newly married. I don't know how many of you all know, but most marriages are still happening, arranged marriages in India. So we faced with a lot of problem. While 70% of our program is from communities and families from India, but we cater to the needs of communities from Pakistan, Bhutan, Nepal, Sri Lanka, the Caribbean diaspora, and now the newly arrived Afghanistan communities. So we're serving anyone and everyone who comes through the building. In 2017 and 2019, everything came together. It was like 10 years of build-up. Our stakeholders listened to us. The foundations listened to us. We brought the data forward. We gave the actual numbers. We were all over in the social media, taking a story to all our partners, our Asian partners, our Latina partners, our all partners here, whoever we could get, our allies. We joined hands with our legislatures, educating them. It's a tremendous job to be working without any funding for the first 10 years. It was just like total dedication. We just have to take the word out. We have to help our families. When a woman comes to our door, totally harassed by the in-laws, the intimate partnership violence. We're not going to turn her away. We build those resources. We find resources for them. We find funding for them. We take them all the way. Each case can take up to 10 years. We have someone with us who is 6, 7 years with us. We're never letting them go. Holding hands, taking them to the court, driving them, taking care of the children, watching them while the woman is attending the court cases. That kind of support is needed. We're very short on affordable housing for single women, working women, and seniors, and victims of domestic violence. Our control wheel is very different. If we can show that wheel, are we able to? The immigrant women's control wheel is very different than the mainstream. There are passports are being taken away. There you go.
Yeah.
There we are. If you need to have access to this, I think we are going to share the website, www.sewa-aifw.org. Please click on it. Call us. We'll be more than happy to share the resources that we have built up over the years. A woman has to go nowhere. One stop, right here. In 2022, we purchased a building. It was a big step moving forward. I didn't know the alternatives. We were begging for meeting rooms, for space to get together. It was a big hassle and a stress on our staff. If you have the space, you'll use it. So we took another very bold step, signed on a building, and we got the building. If you have it, the community will come to you. Now we have every Monday in-person senior programs. They're coming in, 35, 40 seniors. At one given event, we could have anywhere between 300 to 600 people showing through. Last bazaar, the women's bazaar we had, I'm told, 700 women and families showed up for the bazaar. That the need is there. The need to get together, to connect to each other, to support women in business is huge. And we will be supporting them. We reached out to our congresswoman, Omar Ilihan. She's our district. It so happened that she's from our district. We reached out to her. Said, here's the problem we have. We can't afford this kind of building. She listened to us and said, why don't you apply for funding? We did. And she brought money to her district, and we were part of it. We really appreciate a woman of color who listened to us. She knew the pain we are going through. So here we are in the building. We have a space. We have a women's program, what not? I think Mubina will touch base on most of the programming. But the history has been created. There's a space here. We have a very effective board, a cohesive board who listens to the need that the programming that does, what the needs are of the community. The senior, the women, they all love us. We love them because we listen. There's a connect now for all the women who need us. We will make space for you. That's my message to you. Thank you very much. I appreciate that.
Thank you, Raj, for sharing all the history with the audience and sharing all the struggles that you faced and the community faced, all of that. I just want to recognize that we are missing on three speakers today on the panel. Anjali Mishra Cameron, who is now the new Chief Executive Officer, as Raj, after 20 years, is planning to retire, and right now on the executive advisory panel to help us navigate through the bigger pictures for the future. And we truly appreciate her leadership and her role, all her dedication and passion to serve the communities. And just, after 20 years of her invaluable services, she is finally ready to take some rest. And we hope that she finds that fruitful for her own self-care and self-love. So Anjali Mishra Cameron, who is now our new CEO, is unable today to join us, but she has a background in the policy and research and government relations, as well as the community work. That's the best fit for us, for the organization, to have that leadership to move on with the new issues, new kind of, issues that we actually started seeing back in the year of 2020 with the pandemic. Nobody had seen anything before that. So now we are at the point that we need that leadership change as well. So that also there are two other members who are unable to join us. Dr. Surinder Singh Chaudhary, who Raj already mentioned, is one of the founders and leading our men's circle called Gupshup. And Dr. Atul Mishra, who has been volunteering with us full time as a medical director. That's the biggest help we could ever receive from someone who has so much of experience as a physician and as a pediatrician in his career. Now, after retirement, he's like literally donating his time to SEWA and helping us navigate through the challenges that the community is facing with a lot of resources and connections. I want to invite Dr. Dashrath Yatta, our executive co-director, to help us understand the importance of health initiatives, as well as what are most the bigger challenges that South Asians, especially the immigrant women, are facing. And as well as Dr. Surinder Singh Chaudhary isn't available, we would also like Dashrath to be talking about a little bit of background on South Asian Men's Circle and how it is playing a role in tackling gender-based violence. What is the purpose of having a men's circle? And that's another big issue that we have, that we always talk about, educating women and LGBTQ plus or seniors, or people who are actually on the other side of the table, who are actually the vulnerable populations, while we forget to actually educate and talk and listen to the other side, which is mainly the perpetrators, or are seen as the perpetrators or the abusers. But there are a lot of mental health issues among immigrant men and a lot of other pressures, cultural pressures as well. So as a whole family wellness program, we have initiated this program to incorporate men and boys, young boys, to understand the dynamics and become a better ally to victim survivors of gender-based violence. And Dashad would be the best person to give us more details on health initiatives as well as the men's circle. So please go ahead. Thank you.
Yeah, thank you, Mubina, again. So yeah, as Raj mentioned about, we did some Sahat survey, that is health survey. Basing on that survey, we got result that we have a lot of heart diseases, diabetic issues in the community. So that is the reason we started our community-based health clinics, and these clinics are going very great. We are organizing almost 50 plus health clinics in the community every year. So including, we are going to the community-based, faith-based location. We are going to the outreach location, and we are also organizing our health clinic at our office location every Mondays. So that way we are helping the community, and we are doing the chronic diseasement in the community. So we have a lot of disparities, like blood pressure, and we have some cancer cases we are seeing right now, and diabetic and heart diseases are regular. So our plan is to reduce these health disparities. So through these health clinics, we served almost 2,000 people in the year 2023 so with these health clinics. And what we are doing in health clinics, we are doing the blood pressure measurement, blood glucose testing, and BMI, A1C, and cholesterol testing. And we have a volunteer doctors. They are doing the consultation. We have almost different varieties of specialized volunteers with us. They are doing the medical consultation. We have also nutritional consultation doctors. So they developed a My Deshi plate. So it's helping a lot to the community to reduce the diabetic health. So health is wealth, right? Without health, we cannot do anything. It's important to all the men, women, kids, everyone. So that is the reason our mission is total family wellness. So that is the reason the Health Initiative program helping a lot to serve this mission, our mission statement. So we are also organizing an annual health fair here every year. So it's helping thousands of people actually. So we are collaborating with some health hospitals, and they're coming with all the facilities, and we are doing some health webinars, a lot of health screening, and we are doing the lead poison test and cancer screenings, and COVID. COVID is one of the important, we are grantees of Minnesota Department of Health, and we helped the thousands of people. So when COVID is started, we are on the road. All the staff are at the road. So they help like frontline workers actually. So we started the vaccination clinics and testing and recovery work as well. So right now we help with almost 20,000 doses to the community in the vaccinations. And we did the hundreds of testing every Monday, and every Tuesday, every Thursday, regularly we are doing the PCR testing at our location. And rapid test kits are doing every day. And whenever community need, we are asking them to come down, and we are doing the rapid test kits. And we distributed almost 20,000 PPEs and rapid test kits as of now. That way, we are monitoring COVID cases in our community. So we are done amazing job to help the COVID patients, and we are also helped the long COVID patient also. And we are educating the community about misinformation about the COVID as well. So we cannot do all this work because we have a constructed volunteer with us, constructed doctor volunteer with us. We have a nursing students from the Century Nursing College, and we have a collaborative with St. Kate University as well. So they are coming into the clinics and they are helping us. So this health initiative program going very well, and we are always in the community. And so sometime we are every year we are getting the visitors from India. Parents will come, in-laws will come. So generally they will get some health issues. So they do not know where to go, how to tackle the issue. So SEWA is filling the gap, that situation. So we have another issue. I would like to talk about the mental health. Mental health is a big issue in the communities. It's a very taboo issue in the community to talk about it. So South Asian community is surrounded by a stigma regarding our mental health, and regardless of our backgrounds, education, and successes, can suffer from depression and other issues. So that is the reason we recruited 3 therapists. So they are doing amazing job. So psychology consultation, therapy sessions, and we are also doing the mental health fair also every year. So that way we are very much touch with all the community to helping the mental health issues. So we have peer support group, we have a community asset teams, and we are very much connected with public safety department, very much connected with school system, very much connected with the faith-based location, faith-based organization, very much connected with the community-based organization leaders. That way, we are very much connected with the community. So we are educating the community about the mental health issues and doing the basic screening. And we're also referring the cases if the federally funded clinic. So that is the information about the mental health. I would like to talk about a little bit on our South Asian men's circle. Primary concept of this program is that majority of domestic abuse situation are caused by men. We have a men's circle, women's group also. Hence, the problem is not the women, but it's the men. So why not get the men together? That is the concept of starting the men's circle group, South Asian men's group. So here we are doing the what is the agenda of our South Asian men's circle? We will do regular gupshup, and we are also doing the cooking sessions. So that helps to the in the family also, right? That to prevent the family violence in the family. So that is the reason we started the cooking session. So we started 4 discussion topics actually. Number 1 is South Asian men being the head of the household. Number 2, stress that can come being an immigrant in the United States. Number 3, South Asian traditions that are helpful and hurtful. Number 4, personal growth and family cohesion. So every time we are discussing these 4 topics, beyond that, so whatever coming recently, so we are also discussing those topics. Right now we have almost 50 men in the group, our men's group is increasing day by day. Tomorrow we have a men's circle group meeting, and we are going to join that meeting tomorrow. So whole focus is the men's circle is family well-being in the families. So I have other topic, civic engagement. We have a big civic engagement program. So it works to empower new immigrant and refugees by increasing voter participation, advocating to make service more accessible to limited English speakers, and promoting immigrant and refugee input into public financial initiative to ensure their voices are heard and gains are made. So we are doing the voter education and voter enrollment, and we are participating in the phone banking, and we are participating in the national voter registration. We are participating in the census work. We are participating in the hotspot canvassing. So it's totally bipartisan. So we are also involved in the government relations, and we are doing the testimony and so many bills related to community issues. We are doing the coalition building with the various regional organizations and state and federal organizations as well. We are very much involved in public policies also. Recently, we started the NASTAR Act. We are working with NASTAR Act and some domestic violence issues and housing issues also. So that way, we are very much connected with the government, very much connected with the community, and involved with the civic engagement very effectively. So civic engagement is the educating the community regarding the what's happening in the government. So that way we are helping the community about the civic engagement. So anybody have any question on in any programs? I'm ready to. Yeah, absolutely, Liz. I think you are muted.
Ta-da!
Yeah.
Thank you for your very fine presentation. And I think that men helping men is a dimension of your program that has been really important because India and many of the South Asian countries were indeed patriarchal.
Yes.
and so you're approaching this with an awareness of that, but also the unique living conditions in the US. I have a question too. In India, we know there are religious differences. We know when you cross over into Pakistan, they are the Pakistan Islamic State.
Yeah.
So I think we've talked about this, Raj and I, about maybe the majority of those coming are Hindu, but there are also Muslims. And how do you within SEWA manage that?
So we don't have any religions concern. We are totally secular. We cannot encourage any religion. We will welcome all the religions. That is the SEWA mission actually. We always help all the community, all the diverse community. So that is the reason we do not have any barriers to join us. That is the reason people are coming forward to help us. So men's circle, we have 3 generations of people actually. Kids are there, adults are there, seniors are there. We have one kid, he is 15 years, and my highest age is 91. So
Wonderful.
yeah. So we have all kinds of people, all religion people. So we have covering almost now other countries also. Tomorrow, one of the Sri Lankan is joining, and we have Nepali community, and we are covering all the South Asian countries' participation actually, all the religious people. So we never encourage the religions in our program.
Thank you.
Hope you got the answer.
Thank you. No,
Thank you. Thank you.
Raj,
Thank you for
you're-
giving me these opportunities.
Raj, you have raised your hand. Thank you, Dashrath, for
I
the
wanted to fill in,
details.
thank you for Dashrath for covering a lot of, but the diversity that we have in our staffing talks
Yeah.
a lot about it.
Hmm.
We have Christians, we have Muslims, we have Hindus, all religions in the staff. And everyone is very compassionate about working with each other. And so is the community that we serve. All religions that we cover. Why the clinics are mainly in the Hindu temple and the Gurdwara? Because that's where the community was to begin with, started out. We, however, we have reached out to the Pakistan Association and also other organizations, even though the mosques do not have a space to have health clinics. One of the Islamic center in Fridley have their own health clinic. So we would love to join and be able to do health clinics in the mosques as well, but systematically this is not done there. So that's only for religious services, even though social services, they might open up someday, but we would love to do that. And if Anjali may have add something to it, go ahead, Anjali.
She is unable to speak right now, so we will move on to the next panelist to.
Okay.
Sure. I can jump
Okay.
in and try and say a few
Sure.
things. I do want to put a finer point on this issue around, oh, sorry, let me introduce myself. So, hello, everyone. I apologize that I'm not able to join by video. I am Anjali Mishra Cameron. I am the incoming CEO of SEWA AIFW. I've been a longtime volunteer with SEWA, and I'm very excited to join a leadership role within the organization. They do incredible work, which you've heard so much about earlier today. One thing that I want to highlight on this question that Lois raised is really that, religion is just one facet of the complexity of the South Asian community that we serve. So we serve a lot of diaspora communities that have multiple identities within our community. And so whether it is religion, whether it is a caste system, whether it is a number of different economic factors, or there's so much diversity and richness within the South Asian community that it adds a lot of complexity in the services that we provide. So one thing that Raj and Dashrath have touched on is really that we focus on our mission and our values first as an organization to be able to lead with those. And that's a priority because when you lead first with values, when we lead with our principles of belonging, dignity, and justice for our clients, those other things, you look at someone as a whole person rather than through their single identity lens. And so that's really important. And that's what's helped bridge and navigate some of these really complex political and socio-political issues around identity within communities, around political differences. So we do serve everybody, as they have mentioned, and it's really important that we do it adeptly, given who our community is and the history around some of our communities within the South Asian diaspora.
Thank you, Anjali, for jumping in and addressing the question, and welcome to the panel. So as we move on, I would like to invite Amina Baha to talk more about the women's programs as well as the intersection between housing security, total wellness, healing, all different components that are intergenerational, intersectional within South Asian communities, as well as we would love to also learn more about the community member refugee resettlement programming that you have been a part of since a long time. Before even joining SEWA, you have a lot of experience working with the Afghan refugee resettlement work. And yeah, would love to listen to you. You're muted, Amina.
Oops, sorry. Okay, sure. Thank you. So before I get going, I think two of the things that I want to address, I think one of the questions that Ms. Lois asked and also Deshaji also pointed out is the fact that SEWA is a place where just even myself, before I joined as an employee, I've known about SEWA and attended like the bazaar or some of the functions or knew the community members that were a part of it. So it's not just about programming and services, it's about feeling at home or finding your quote unquote tribe. And that's pretty much what SEWA is. So with that, I'll go ahead and get into what my role here is. So like I stated earlier, I work with the refugee resettlement programs and an awesome program within the women's so sorry, I'm gonna go back. It's my third or fourth week. I have been here less than 2 months, so I'm still trying to figure out like what I do and all that good stuff. But we all at SEWA wear many different hats, as you've probably heard. So if I am off topic, please definitely correct me and pull me back. So I run the refugee resettlement programs in an awesome program called Chai and Chat. Sorry, I'm thinking of chat. So for immigrant and refugee women, it's a space where we get together and learn about each other, heal, network, and build our community. In this meeting or socialization happens in person. We have workshops that we have set up for the rest of the year. And so far we've had a yoga workshop, a workshop on Momo. This month we're gonna be hosting a spring bazaar. And some of our future workshops include a poetry workshop, a self-defense workshop, life coaching, financial literacy, and self-care, just to name a few. And then as far as SEWA is still and was one of the bigger rock star in Operation Allies Welcome, or known as OAW, which is a name given by the State Department for the Afghan evacuation. They welcomed our Afghan community members and friends in 2022, despite all the hurdles. They're still doing what they can to serve this vulnerable population, whether they're recognized or funded for it or not. And honestly, that's basically the essence of a community organization and what organizations like SEWA does. So we're all about, as you've probably heard, about the South Asian community, right? Being there for all of us and making everyone feel at home, safe, and helping them grow. And especially our recently arrived Afghans, due to the decades and recent war trauma and displacement that they've experienced. SEWA's provided ongoing housing support, interpretation support, as well as driving lessons to women, allowing them to empower themselves, make themselves sufficient, as well as helping them find a path to financial freedom or independence. And of course, in doing this, or what we would like to achieve in the future, we've run into many red tapes and systematic barriers, right? But we're not going to give up, as you've probably heard from Raji in the last 20 years, regardless of whether we had financial resources or human resources, we never gave up. And that's the whole idea here. We're not going to give up. We plan to partner with local agencies and resources in breaking barriers, as well as making big moves so that our community has access to social services, improving literacy, fighting fair education, helping folks get their education credential from their respective countries recognized here. So yeah, we're all about connecting people with jobs that make them feel respected and valued. And that goes back to me, this whole resettlement of the refugee network, not just refugee, I would say anyone moving from one country to another. It's a full life circle. You can't just support them in one area. You've got to be able to help them integrate and move through the whole, like a wheelhouse, right? Help them integrate into the new culture. For example, in a total family wellness perspective that SEWA aims to work through in the world of refugee resettlement, that would look like us addressing affordable housing, providing healthcare services, education, employment opportunities, community integration, family support services, legal assistance, and most importantly, cultural preservation. Of course, SEWA can't do all these things. We do most of it, but things that we're not able to do, we have or plan to build partnership with those agencies that can assist and walk our folks through some of the barriers or issues that they might be having. So for example, in the realm of legal assistance, we don't have any lawyers, and even in the system of law, immigration law is just it's its own ball of yarn that just keeps wrapping. So we've got to build on those types of support services and referral networks so that we are able to refer folks to them. And I think, yeah, so please look forward to how we are going to be planning to serve this new vulnerable population. Like I said, majority of these programs are already happening or exist at SEWA, and folks are coming to them, and we just will continue to do our outreach, bring more folks in, and the others, we're just going to continue to work through them. And if anybody has any questions, please feel free to ask.
Thank you so much, Amina, for bringing all the different aspects of the resettlement work for not just for Afghan refugees, but all the immigrants who are in a new country and trying to make it their home. Next, we have Arti Raghavachari to talk more about the creative ways that South Asian youth are being organized here at SEWA, and how we are advocating for justice within the youth. What are some of the barriers that exist in youth receiving supportive services? Please go ahead, Arti.
Sure, thank you so much again. I realized that when I introduced myself in the beginning, I actually neglected to introduce the youth programs in general. So I would like to actually take a couple minutes to do that first and then respond to your question. So I just wanted to start out by saying that the current existence of the youth programs is an expansion of the services for the last years. So like I said, I joined only a year and a half ago, but this program and this like model has been in existence for the last few years now. So I'm really just taking it and expanding on that. And just wanted to share that the mission of the youth programs is to create a safe space for South Asian youth within the Twin Cities by engaging in thoughtful dialogues with one another, enhancing connection, supporting each other, and celebrating the diversity in each other's mindsets and identities. So these are two unique peer-to-peer groups known as Suraj and Chand, which are a crucial work in creating a safe space for South Asian youth to come together through both similar and dissimilar identity, networking, and engaging in immersive, fun, and creative activities to foster community and collaboration. So Suraj, meaning sun in Hindi and many other South Asian languages, focuses on leadership training, professional development, zines and mandala making, field trips and youth retreats, social media safety and culturally specific and culturally responsive, safe, inclusive sexual health education, as well as beginning to learn about situational awareness as a form of self-defense. And the other group, Chand, which means moon, utilizes internship and job opportunity resources, talking about life and safety skills, transformative justice, creating violence preventative resources and healing methods, and participating in self and community defense trainings. And then there's also an online book club, Baat Book Club, which really is for all age ranges. In the past, we've had folks even in their 30s engaging with teenagers or like folks in their 20s. So it's an intergenerational space that discusses different genres, and it's a really accessible space because it's virtual as well. And then there's a Life Without Limca podcast that we've done in the past, which has been traditionally focused on like identity, intersectional identity discussion, and just for a youth-led space to be about how to navigate relationships with their family members or how to navigate healthy relationships with their peers. And I also wanted to mention that last Sunday, we actually held our safety kit event in which we distributed 5 different safety kits that I and other staff members intentionally created with different protection tools for youth to keep themselves safe. And the age range of this group actually was from 9 to 13. So we had a 9-year-old in the space who was really telling us what he sees as a safe space and what is an unsafe space, and how to thoughtfully just engage in violence preventative from a 9-year-old perspective, which I think is really awesome. And I just wanted to include that. And the history of why the youth program came to be is because we have been seeing really high rates of teen dating violence, domestic violence, stalking, mental health concerns, toxic and unhealthy relationships, lack of puberty and sexual health awareness. Youth are also secondary victims for gender-based violence if their parents or their guardians are experiencing violence. And then there's also an overall need for connection with other South Asian peers. So it's really crucial for us and SEWA to create an inclusive and safe space for these youth so that they can come together and collaborate with each other and advocate for themselves as well as their diverse needs that they all hold. So that was just a brief overview of the youth program. So if I may, I'll just briefly talk about the creative ways in which youth are organizing themselves, and also some of the barriers that exist in youth receiving services. So as we all know, South Asian youth in the US and abroad have historically been involved in organizing and creating awareness for social injustice. So in the last few years, they've begun expanding their networks to more digital platforms. So TikTok, WhatsApp, Discord, Snapchat, Instagram. These are all very obvious ways in which the youth are archiving their stories and their narratives and just showing examples of what it is that they are experiencing and what they need from other community members. Youth are really creative in telling their stories and, of course, extremely diverse in terms of their varying needs based on their intersectional identities. As it's been mentioned countless times already in this panel, we work with so many different cultural communities that it's kind of difficult. It's a challenge to navigate all of these access points and needs. But that's also a good way in fostering intergenerational dialogue between youth and other community members. And some of the tools that they use include political education, art, and activism in creating dialogue, and also different modes of healing for themselves. Something I also want to bring up is that today, what I'm seeing is that many South Asian youth actually recognize that there's an interconnected system that plays into both systemic and interpersonal violence, and oppression such as homophobia, transphobia, misogyny, capitalism, racism, and casteism. So South Asian youth are really taking notice of this, and not only are they like collaborating amongst their peer groups, but they're also forming transnational community groups through their digital platforms. So they're able to connect with other youth in the diaspora and, you know, reimagine a world that achieves collective liberation. And finally, some of the barriers that youth face in receiving supportive services are the lack of awareness that comes with that digital access. So some examples include extortion, trafficking, revenge porn, cyberbullying, and digital abuse. So like the negative side of that expansion towards digital platforms. I'm also seeing that youth are facing disconnection and estrangement towards older generations in terms of different needs in religion, culture, and expectations that are placed upon them. Not just those that are born and raised here, but across the globe, in the diaspora. And then also youth survivors of gender-based violence also face a lack of support from their family when there's stigma towards domestic violence, sexual violence, and teen dating itself. So I say all of this, and I also wanted to make a huge point is that we're also very much witnessing a mass scale targeting towards young people and their bodies and their autonomy. So because youth are such a vulnerable population, it becomes a collective responsibility for all of us to work together and work together against the criminalization of youth and continue to spread awareness of what is healthy and provide resources to get rid of these gaps and make for a healthier, healing youth community. So thank you.
Thank you so much. I believe that the development of SEWA could be a model or a prototype. And in addition to developing the different segments of your program, which are really awesome, that you could have kind of a little story of how you did it to reach out to the community and make partnerships and get grants. And I think a lot of NGOs are really struggling with that. And it might be something to think about. Sarah? Hello, Sarah?
Yes, Lois?
Yes, we have about 10 more minutes according to the webinar. Is that a fixed amount of time that our recording will stop at the end of the 90 minutes?
No, we can proceed on.
Okay, good. So that's the answer to that question. And we will be sending to all of you the recording of this webinar. The first time we ever did a webinar for the UN was last year, and it was so well received. And this year you have even more good news to tell. But I want the audience to be aware that we are part of the Commission on the Status of Women at the UN. It started Monday, actually Sunday, and this webinar will go all over the world.
Thank you for sharing that. And yes, about the framework that we have developed over years, all the passion and compassion and the empathy that all the staff members, multilingual staff members, very much culturally embedded and rooted in the justice movement. That's the framework that we have been sticking to and developing more, and that could be the role model for a lot of the organizations who are developing their programs for the underserved and underrepresented communities, refugee and immigrant from across the world who come and live in the United States, particularly in Midwest. Being, not having a lot of resources, even mainstream population, and the organizations are at capacity. And while we are struggling with, cultural and linguistic piece, our services become the core strength, and a lot of people look forward to join. Raj, you want to add something, or should we move with the seniors programming with Rohini? You are muted.
Yeah, sorry. I want to quickly add that there is poverty in the South Asian community. And it's hard for people to be convinced of that because we carry such a mask over our face. And also, they see the high-tech people, and that they're earning enough, or they are physicians, but the numbers talk otherwise. There is, as of Census 2010, I have not looked at the recent ones, that there is poverty in the South Asian seniors. We are the number 2 at the poverty level in Minnesota. And that's eye-opener for many of us who think that we are so rich, but it's not true. Our work is focused towards the vulnerable and underserved communities, and that's what these are. And these are the communities, there's literacy problem, there is poverty issues, and then there's the domestic violence that has no economic facts are needed for that. It's across the board. We have physicians coming forward that have faced domestic violence. So, so such is the nature. Those are the community we are looking to serve, and we are serving. So that is for many people in our own community. When we are sitting in a faith-based temple or gurdwara or even a mosque, they will come and say, do we have issues around domestic violence? I did not know that. I did not know that. Then we have all the control and the resources, everything laid out on the table. They say, okay, give me the blood pressure one, the diet, and all those brochures. The domestic violence, no, not that. Lest they be seen as having issues in the community. There is that stigma And then there is that mask that we are wearing, that we are all okay. It's not true. So we want the community to be aware that the numbers speak otherwise. There's a high school survey that came out that talks very openly about the mental health and the suicide thoughts between 6-year-olds and 11-year-olds. So there needs to be a parents' education. Education needs to be given to parents to leave the kid alone and perform, and do not put extra stress on them. Why did you not get A+? Why did you only get A or B+? So that's the kind of mental health issues we are seeing in the community. And there's no data for that. So we are looking towards doing another study of the South Asian community that deals with, first of all, how many seniors live in the assisted homes, independent homes, and how many children are facing this kind of stress. All that data needs to be done. The health assessment is overdue now, again, because of the growth that we have seen in the South Asian community and the Asian community at large. There's fourth-fold of increase in the growth of the Asian population. So much work needs to be done. And we are here to serve. A space has been created. We are here to take care of them. Thank you.
Thank you, Raj, for touching on very important issues of one, underreporting, and second, the model minority myth that we always face while working with South Asian population diaspora. And as a forefront direct service organization, we are invested heavily on working on the underreporting issue and becoming the liaison between the abused people with the systems that they are afraid to go to. As well as we are heavily invested in dismantling the model minority myth that is hurting a lot of communities, which is underserved and underrepresented, very vulnerable population. And that's where this, it's just not that our focus is on the community work, but also the system change and bringing the voices out to the lawmakers and decision makers and Congress and other, areas where we bring those voices, we become those voices for making our laws better for immigrant and refugee populations. So thank you so much, Raj, for bringing in the issues around this two major issues that we face, and we have been working on to address those. I would like to invite Rohini to talk more about the seniors programs and what are some of the highlight some of the challenges we face, as well as like what are some of the benefits that seniors age 60 and above are benefiting from our programming at SEWA.
So first, before I started, there's a proverb saying, a senior's body may be older, but they are still young at heart. So yeah, so that's what we have. This actually during this the seniors program, as I mentioned before, is started in 2020 during the COVID time. That is where the seniors who are living alone had nobody, they didn't have access to any meals or going out because all the stores were closed. They couldn't go out and pick up meals. So we got a lot of call. Raj used to get a lot of call from them, seniors asking, please, can you help us? So, and also at the same time, the George Floyd event happened. And it was just few blocks from our office in East Lake Street. So at that time, we had to close up, and Raj was really looking for a place to start the senior meals program. So I said, Raj, it's okay, we can start from my place. So that is where it started. And now it has expanded, and even now we have more calls for more services for seniors. And so now we have the meals program, which goes out twice a week. And it's also culturally specifically made for them. And according to that My Desi plate with the protein and everything, we are sending that, and also groceries for them. And then the next one is we are there during the COVID time is when they were all locked up and they had nowhere to go, nothing to do. So they were all getting depressed, and also they were lonely. So at that time, we started the senior social, and now that is being of great demand right now. Even though if we don't stop one day, they will ask, why are you stopping the senior social today? So say we have some other program going on, so we cannot have it. So they are so much attracted with that. And also we have a lot of transportation requests for medical appointments, and and also necessary outing for groceries like that. And we do the supportive care, like call them, talk to them if they need any help, and so go to their house and check them out and stay with them and provide some help. And if they need, we also do the dementia testing, or at that place we do screenings. And also by starting this clinics, I think it has helped them. So everybody go monthly, they go twice and get themselves checked up. And also they are getting treated. And so treated for any health problems, or the doctors are there and they are given advice. And we are still we are trying to do more for the seniors. And for us, for our challenges we face is with more people, we don't have volunteers or drivers to pick up. And now it is being done by staff members, where they have a lot of other things going on, and we have to drop off everything and do the seniors. So that is that is a challenge. And also the funding for the meals program, and also for the groceries or any help they need, that is also a big problem for us for right now. So yeah, so that is what we are trying to change. The socializing is they are very happy to come here and socialize, and we do some artwork with them, jewelry making, walk with ease, and all the programs. They are enjoying some Bollywood music. They are dancing and playing bingo here. So that is how they keep themselves engaged and also not depressed.
That's wonderful. Thank you so much, Rohini, for sharing all the nuanced services that we have to offer to our senior population. And as we are moving on with our program, I want to just touch base upon the role that I am playing here as a community advocate, working with victim survivors of gender-based violence. Most of the population that come and the calls that we receive on our 24/7 crisis line are almost 70% of them are from immigrant women facing gender-based violence. That is to say, violence within domestic setting, as well as non-intimate partner violence. That is to say, violence within communities, violence from the in-laws families, violence from the ex-partners, for example. So a lot of different forms of violence that we see in the immigrant and refugee communities. I work directly with the population to become that middle a voice, the liaison to work with different systems, say law enforcement, court systems, county services, federal services, immigration services, legal services, pro bono legal and low bono legal services, for example. And again, our framework, BDJ framework that we have been using is belonging, justice, and dignity. And that's where we are very keen on giving that sense of belonging to the victim survivor who at a moment feel that there is nobody to listen to them. So the first step for any community advocate or anyone working at SEWA is to give that sense of belonging to people who come to our doors for the help or the support or assistance, whether it's legal, whether it's emotional support, whether it's court cases, whether it's child support, whether it's financial support with, paying the bills, for example, or rental assistance, for example. So there are like multiple ways we are approaching the issue of domestic violence, sexual assault, sexual violence, intimate partner violence, non-intimate partner violence, violence by the in-laws, violence by the community members, violence at workplace that also is very intersectional with their caste identity, class identity, religion, language barriers, immigration status, all of that. So it's not just one-dimensional. And that's where SEWA has very holistic approach to look at a person as a whole entity, not just one identity that you see in the mainstream portraying South Asians as just one or just as, very homogenized entity. So that's where SEWA plays a very crucial role in addressing these issues while also maintaining the dignity of the person as a whole, not just one identity. We also have very amazing, very popular now program for LGBTQ plus identifying folks, and that is SAQL, South Asian Queer League. We initiated that back in 2020, and soon we had pandemic, and that we turned our in-person programming to virtual ones, and once a month we used to meet, and we had seen a lot of cases wherein the participants, young participants identifying queer or lesbian or trans, they are hiding in the homes. They are hiding behind the doors of a bathroom to talk and be there, to just have the feeling of, validation for their exploring their sexual orientation or their gender identity. And that's where creating these spaces are so very important for the people of color who are struggling with the resources, which are very mainstream. Nobody is there to understand the complexities of different identities. And that's where our work is bringing all together and making it very cohesive. And that's where most of the programs are intergenerational in multiple languages with multiple, layers that is incorporated with cultural healing, cultural components, the food, for example, the languages, a lot of, nostalgia that bring in within the population. First generation, for example, all these events, when we have all program events, all these components are there to make them feel at home, as Amina also mentioned. That irrespective of their identity, it is the whole person, it is the culture, which is very common across the global South. And that's where we become unique. We are the unique organization bringing all together and putting things all together to make it more accessible for people who have different needs at different point. With that, I want to just talk about our last year 2023 gala, wherein we had almost 400 people joined us. And the main focus of our program annual gala was this beautiful theater piece. This theater piece is called I Am Enough. And we collaborated with a very famous, very amazing organization, theater company that is Pangea World Theater. And the leaders, Meena and Dipankar, they both worked very hard with us to create this script, which is based on the real narratives of the people we serve and who are the victim survivors of domestic violence, sexual assault, sexual violence, violence by the in-laws, all of that. So this piece is created with the real narratives, and the actors you see will they are all community members who are part of SEWA services, or they just want to be there to support services, or they want to learn. I request Sarah to play this small clip to see the video of the theater piece. It's beautiful, it's amazing, and you have the link in the chat. So later on, you can go and watch it as well. It's the full gala for almost 3 hours. That's a lot of time. But for this theater piece, there's like 30 minutes of it, but we are playing some 5 to 10 minutes maybe to get you the sense of what it looks like and how we are using these issues to create more awareness in the communities. A lot of people in the audience had no idea what a shelter is, or what it is to think about from a male perspective. For example, I was there and I was listening to a lot of conversations around while people were watching this piece. So here we are, and we request you to go to the channel as well to subscribe and learn more. You may have to turn your sounds a bit louder to listen to this properly.
साड़ियाँ है ना, ये सारे इसकी जो बॉक्सेस में डाल दो, ज्वेलरी भी बॉक्सेस साफ कर लेना, इसको पूछ लेना अगर कुछ उसको ना पसंद आया। ओके ठीक है, ऑल राइट, टेलर इज नोस, ही नोज व्हाट टाइम इज ऑलरेडी। जल्दी करो जल्दी, हो जाएगा, लगानी है लाइट्स राइट। ओके ठीक है, ही नोज द टे। कब घर आ रहे हो, जल्दी करो, सब कुछ लेट हो रहा है, सब कुछ लेट हो रहा है। हंसना कम करो, मेहंदी अब पैरों पर भी लगा दी, जल्दी। ये बॉक्सेस पूरे हैं इसके लिए बराबर। ओके, और क्या चाहिए अब? लहंगा उसका जरूरी लेके आना है।
It is September and I am so happy. It feels like I'm in a fairy tale. Like I'm in a Bollywood movie. My handsome Prince Charming, मेरे सपनों का राजा, will come and take me away to the snowy lands of Minnesota. Honestly, I never believed that I could ever be so happy. My prince will come on a beautiful white horse and take me away to this magical castle. Well, no, actually he lives in a place called Eden Prairie, right. Eden Prairie doesn't sound as romantic as St. Paul or downtown Minneapolis, but it's fine. And he lives in an apartment. But who cares, right? I know. My prince will keep me warm. He will take care of me. I hope he's like my father, who is warm, gentle, nourishing, and laughs at my stupid jokes. Now I have to finish the rest of the legs. Come on. my God, I only have 15 days left. I have to do a lot of shopping for warm clothes, jackets, sweaters, socks. Mom, I have to do a lot of shopping. Well, only because we are going to be on a budget, only for now. I know, my prince will do well. And I dream of a cozy home with some lovely friends hanging out at the backyard. You know what? My mom has asked me to look for a suitable groom for my little sister. I will try my best because this is my duty. सुनो, duty बोल रही है। चलो, ठीक है। ये वाला step, हाँ।
Outside, it's a gentle golden hue. I pray for the evening to never arrive. I hear the sound of his car. Terror spreads through my soul. And I wait. What will it be today? Plates flying in midair? The sound of the ladles as they make contact with my head, food splattered on the ceiling that I will have to clean. Can he hear the sickening thud of my heart, the silence of my breath? There is no end to this terror, no help. I can't tell my parents, can't tell my friends. Will this long night never end? Finally, the morning's blue sky comes and it's another day. At least it's not Sunday. I never knew the oppression of Sundays before. I never knew the taste of fist against mouth, of body grinding against a womb that refuses, of rupture of mind and body, of sobs that never get heard. Even the car screams as it speeds away. I gather my thoughts today. Another weekday. I lift my bruised soul. Try to live in the moment, finding solace in absence, praying for courage, savoring this temporary reprieve, this space where I ask, why? Why? Why is this happening to me? Did I do something wrong? Say something even. Won't you look at me? Look at me! I am here. Help me, please. Help.
You keep complaining to me, but don't do anything about it. Maybe you like it?
तुम तो अंग्रेजी में भी नहीं बोलती. You don't even speak English. Who do you think they are going to believe, huh? ఇంకెలా ఉంటాడే మొగుడంటే ఇంకా నీ అదృష్టం అనుకోవాలి నీ వయసులో ఆడదానికి పెళ్ళవ్వడం. It's not easy for women your age to find husbands. अरे ये सारी तेरी ही तो गलती है. It's completely your fault. He houses you, he clothes you. All you do is complain. If what you say is true, then you are the one who is failing him as a wife. Huh?
So this is a longer piece, as I said, almost 30 minutes. But you have the link in the chat to go to and watch this amazing video, as well as the entire gala video. We had amazing performances and a lot of amazing speakers on that day, with almost 400 people as the audience. So you can enjoy that later, as we are having this time crunch here. But before we do anything else, I would like to invite our new CEO, Anjali, to just talk a bit more about the future of SEWA, what we are expecting, how we are expanding, what our goals are for the coming future. And if anyone have any questions, you are free to message in the Q&A section, as well as in the chat is all right as well. So yeah, please.
Thank you, Mubina, and thank you for highlighting that theatrical performance at last year's gala. I think one of the really important pieces about that performance is that not only was the script developed in partnership with Pangea Theater, but it was actually a year-long partnership between SEWA and Pangea Theater that focused on the collecting of narratives from our survivors. So Mubina played a pivotal role in making that project possible in terms of working directly with survivors to do story circles and narrative collection that then fed into the theater performance. So what you heard in that theatrical performance is actually based on the real life experiences of survivors that SEWA has worked with. And I'm excited to share that we are tentatively looking at April 27th to do an additional performance of that theatrical programming and adding in additional stories of survivorship for South Asians in Minnesota. So that includes some additional identities where we think about trauma and survivorship and how important it is to elevate those stories. And so Mubina is working on some additional narrative work and story circles with Pangea Theater. So very excited about that. As she mentioned, I am the incoming CEO for SEWA. SEWA is not a new organization to me. As I mentioned earlier, I began volunteering with SEWA in 2007 and continued to work with SEWA throughout my career, whether it was in a capacity as a volunteer or professionally on behalf of state government as a partner organization. So SEWA has led in a lot of ways in their approach to providing support to communities. There's no organization like it within Minnesota. One of the really important things about SEWA is its service delivery model. And if you've heard so much about the programs today, and what I want to highlight for you is that clients across these different programs, there's intersectionality to them. There's an element that you might fall into one category, but you may need support in another way. So our seniors, Rohini highlighted the fact that seniors come in for socialization. They might need nutritional support, but they might need to also take advantage of our health clinics. And so we do a lot of work to make sure that needs are met across different program areas, recognizing that the circumstances that lead to someone needing help might mean that they need to support across our different program areas. The other thing is that that makes SEWA really special, and why I wanted to be a part of this organization is that we see our community based on their lived experiences. So we work with our clients across many different areas. And so when you think about what our service delivery model looks like, it is different from the traditional nonprofit service model where we have programs and participants. We have a whole person before us, or an entire family, and we problem solve together with how to get to a place of sustainability and success for that individual client. So how do we get their needs met so that they have a sense of belonging, so that they have a sense of overall social support and connectedness to their community? And so that might look like a lot of different things depending on their needs. And so SEWA can't be an all-encompassing service program, but we do provide as many supports as we can that are responsive to the community. And then in addition to that, we maintain partnerships with organizations that can provide those supports, always with a warm hand up, always knowing that we need to make it as frictionless as possible for our community members. Otherwise, there are so many barriers stacked against them that if we do not provide those supports, we're going to lose them and they're not going to get the help that they need. So all of that to say that SEWA is continuing to grow in all of these areas. We have grown so significantly in our 20-year history. This is our 20th year as an organization. And thank you, Raj, and the SEWA team for providing so much sustainability around this organization and growing it so significantly. You know, what the next 20 years look like is continuing to provide the services that we are providing and expanding on those. What we have learned, and particularly during the pandemic, is that these services are critical to our community and the need has only grown more. So you'll see expanded services for seniors, expanded mental health services. Yeah, you've got the packet, Lois. Thank you for holding that up. That is we provide a lot of supports, and we are recognizing that the need is greater than we could have imagined. And so what is really important for us is growing with the community and recognizing where there are shifts in the South Asian community, we will respond and be responsive to our community in those ways. So we'll continue our current programs and we'll just expand upon them. Mental health and suicide prevention is one of the things that Raj and Dashrath mentioned that is just a growing need following the pandemic. Our youth programs, there's a lot of complexity around how youth interact, especially with second and now we're third generation South Asian Minnesotans. And so supporting them as they navigate what their identity is and making sure that they're doing it safely is really important to us as well. So we'll continue to grow, and I'm excited to be a part of the SEWA team. As you've seen earlier today, that we have just an absolutely incredible team with experts each within their own field. And so we're very, very fortunate to have this group. Thank you so much. Rubina, do you want to open it for questions? Yeah.
Thank you, Anjuli, for your insight and your leadership. And we have the flyer on the screen for a lot of different programs that we are offering, including civic engagement and research, South Asian Men's Circle, all of them that we talked about during our session. And I would like to invite Louise Herman to talk, give her insight, talk about her role, maybe just help us close out the session.
Thank you so much. I am excited when I hear such a sensitive professional, experts and expertise, and you all care. I can feel it in your words, in how you present your segment of this program. I remember when we sat around Raj's family dinner table and said, we need to do this. And here it is. It's a miracle in its own time. And assuredly, the world has changed. I mean, it's including COVID, all the fighting, all the conflicts. But you approach people as a whole unit and understand their needs. And that is the key to SEWA's success. I put in the chat about our program One Run, the Women's UN Report Network. I put our website there. We broadcast all over the world every day on the human rights, oppression, and empowerment of women and girls. And I would love to have that sheet. Let me grab mine here. If you could put the front and back on one page, either horizontal or vertical, I'll send it everywhere to a cross-sectional audience, because this is a story of success for the South Asian community here, and others will learn from it after today. Remember, this is part of the UN Commission on the Status of Women. It's on their platform. And so people who couldn't maybe see today will send out the link to the video, and I hope you'll share it with all your connections. It's really special.
Thank you so much. Thank you for supporting our vision and mission and continuing advocating for women and girls across the world.
And thank you, Sarah. Thank you very much. I appreciate it. Helping us put all this together.
Yes.
Thank you.
Namaste.
You're welcome.